Happy Black History Month, everyone. First, let me thank Mike Barsanti for those very kind words. So we are live streaming, and so I'm thrilled that we have the opportunity to talk to have this event here in the reading room at the Library Company. But with live streaming, of course, it means that many other people across the nation, across the world, can tune in. You know, having events here at the Library Company connected to the program in African American history are always sort of dynamic and engaged, and a great opportunity to have scholars and other folks from the community sort of come together to think about the work that we do at the program in African American history. It's work that is extremely important, and I feel humbled to have been a part of building the program in African American history. And as Mike said, we've done the work of securing the endowment for the program, at least for the things that are of the most importance for us, for fellowships, for acquisitions, for public programming like Juneteenth, like Black History Month. But, you know, for those of you who history connected to the diaspora, don't close your pocketbooks yet. We have other things that we need to fund, summer scholarships for undergraduates who come and work here with the director and with the curator. And I do want to take this moment, since this is our first sort of public event, I want to take this moment to welcome our new curator in African American history and librarian, Jasmine Smith, who has joined us, yay, after a long and exhaustive search, and I'm so happy that you've come on board to participate and help grow this program. So while I am going to be passing the baton in terms of leadership for the program, you know, I'll always be a part of the Library Company. You won't be able to shake me that quickly. And I think it's important that fellows and directors, people who have been connected to the program as the first director, that will always remain networked and connected and coming back to the Library Company, because at the root of our program, scholarship is the center. It hinges everything. And so given the work that I do, I know that I will be back frequently. But enough with that. I'd like to move on to introduce today's speaker, and to sort of have us meditate and settle ourselves to think about the importance of this month, the importance of the kind of work that I do, that Dr. Cooper Owens does, that we do every day, all day, 365 days a year. It is important for the Library Company, but of course it is important as we move to write the narrative of American history. So it's truly an honor to have Deirdre Cooper Owens here with us this evening. Deirdre Cooper Owens is an assistant professor of history at Queens College, CUNY. She holds an MA in African American Studies from Clark Atlanta University, and a PhD in history from the University of California at Los Angeles, where she also received a certificate in women's studies. Cooper Owens has received numerous awards and fellowships, including a residential postdoctoral fellowship at the Carter G. Woodson Institute for African American and African Studies at UVA, and an American College of to explore medicine, gender, and the historical influence of race on each of these categories. And I think I'm allowed to say this, but she was just recently named a distinguished lecturer by the Organization of American Historians, and that is a significant acknowledgement and a reminder that not only are you supposed to now lecture for the OAH and give them the money for it, not only are you supposed to do that, but it's a recognition of her position in the field, her prominence, and a respect for the work that she does. Her incredible book, Medical Bondage, Race, Gender, and the Origins of American Gynecology, was published last year by the University of Georgia Press in the Race and the Atlantic World series. And that's a series that has very strong ties with the Library Company of Philadelphia. We have a good deal of the fellows who come through this program actually end up publishing in that series, in that very well-regarded series. Professor Cooper Owens has taught at a number of colleges and universities where she's focused on classes that emphasize the United States, slavery in the United States, race, gender, and medicine. And tonight we'll have the privilege of hearing her to give a book talk for us about this newest project that is still sort of new and exciting, and folks are buzzing about it. So I'm thrilled to be able to introduce her and to invite her to talk with us this evening. So, Dr. Cooper Owens.
Thank you so much. It is so wonderful to be here. First to see, after I take off my glasses and I can't see, but to see so many faces that I know. And then there was actually a funny story. I'm looking at this young woman and I'm like, I know her. And so finally I said, I'm sorry, your face looks so familiar. You taught me as an undergrad at UCLA. And I'm like, oh God, that was 50 pounds ago when I had hair. But now she's in a PhD program. And so how wonderful is this news? I want to first thank Doctors Michael Bersanti, Director of the Library Company of Philadelphia, and Erica Armstrong Dunbar, Director for the program in African American Studies, for extending an invitation to me to present my work on the enslaved and early Americans in such a remarkable and historic institution. I'm grateful to Claire Lowry for providing logistical management and magic, as I call it, getting me from Brooklyn to here, and the staff members and Library Company Fellows who are dear colleagues, Nazira Wright and Cheryl Hicks. Thank you for being so collegial. Lastly, thank you to all library shareholders. I did my research. I heard some gentlemen in the back talking about shareholding, so welcome. And also to members of the community and Philadelphians who are residents of a Super Bowl winning or come out on a brisk night to learn about my work on a group of people who remain really important to me, enslaved women. And so before I begin the talk, I'm a kind of intuitive teacher, I call it. If I put on my glasses and I see some eyes glazed over, I'll step away from the paper, right? Because what really brought me to history was stories. I am a native of South Carolina, and I was sharing with Mike, my family, at least in this country, goes back to the Low Country in South Carolina, to the 18th century when it was still a colony. And so I come from the Gullah Geechee people, and so I remember my grandfather, who was born in 1911 and helped raise me, would sit us on the porch and just tell us these stories. And I never really thought of them as history lessons until I became a historian. And I thought, oh my gosh, the church he's talking about was built in the 1730s, and so he would tell me about these visions of hearing chains kind of clanking in the basements of the church when he would clean it, and I just thought, oh, he's a good ghost teller, a ghost storyteller. And then I later found out, right, that in fact this was the location in my town where enslaved people were kept before they were sold off, right? And so those are the kinds of stories that kind of sat inside of my heart, my mind, and really led me to the pursuit of understanding and growing in love with United States history. So thank you for allowing me to share my work with you about these people. Rody, a 34-year-old North Carolina enslaved woman, was distressed about her health and shared her worry with her owner, Thomas Robinson. Robinson waited 1 year after Rody did not give birth before he called for local doctor W.P.L. Jennings to examine her. Rody informed Jennings, and I quote, that she had gone over 12 months with her child, then in utero. The physician described Rody, a mother of 5 children, as, in his words, a woman of unusual good sense for a Negro. but also determined in the end that she had lied to him about the true nature of her condition. It is quite possible that none of the parties involved imagined that Dr. Jennings would treat the bondwoman for 6 years, from 1843 through 1849. He consulted his colleagues and they determined 2 possible causes for Rody's puzzling obstetric condition. Either she had an extrauterine pregnancy or was infested with tapeworms. By April 1849, Rody's health deteriorated quickly. She suffered from painful diarrhea and tenesmus, a cramping rectal pain. The doctor and his team examined her fecal matter and found 2 bones from an infant, one from the spine and the other from its foot. It seemed Rody knew her body better than Dr. Jennings and all of his most respected colleagues who puzzled over her ailment for years. When I write about the medical experiences of bondwomen like Rody, a woman who carried a dead fetus in her uterus for 6 years, while white medical men characterized her as dishonest and possibly infested with parasites, I hurt. I am filled with questions. How did she continue to mother her 5 living children, although she believed deeply she was carrying a dead child in her womb? What physical sensations did Rody experience after each doctor's visit when Dr. Jennings and his peers were attempting to locate the source of her pain? Did she flinch when they pressed their hands and instruments against her stomach? Was she embarrassed when she relieved herself in front of these men? Were her children holding her hand when she died April 18th, 1849? Were her family members at least informed when an autopsy was performed on Rody as a cadaver? Was her fetus either destroyed or preserved? My questions do not have answers that can be retrieved from 19th century medical journal articles. Black women's voices like hers were silenced, and white men decided which words and actions their enslaved patients would be recorded in the pages of their professional writings. Positioning my questions and letting them guide the ways I read sources helps to disrupt these silences. So I share the story of Rody, an enslaved woman whose medical experience didn't actually make it into the pages of medical bondage, to show exactly how many stories have been left unread for centuries. And as I stand in the middle of a reading room in a colonial era library, I think about all of the stories that are contained in these books and these journals that are just waiting to be revealed. So it really is a quite moving experience for me to be here. But also to have us consider that many advances in American medicine developed because of the vulnerability of populations not allowed to share their stories, like the enslaved. In tonight's talk, I will provide an overview of how my work broadens and nuances the discourse on enslaved women's reproductive health during the antebellum era. And so although my book focuses on both the enslaved and Irish immigrant women, I'm not going to go into the Irish immigrant stories as much, but I will certainly answer questions during the Q&A if you have them. I tend to focus in these kinds of talks primarily on the enslaved and the white pioneering medical doctors who treated them. So my research is really based on an integration of the history of U.S. slavery and medicine, centers Black women's experiences as medical patients, and also in one particular case that I will talk about a little later, their contributions to American gynecology as surgical assistants. In 1985, historians Deborah Gray White and Jacqueline Jones inserted women into the formal study of American slavery, finally. Historians examined enslaved women's labor, both productive and reproductive, so outside of the home, inside of the home, and how the group resisted and negotiated their bondage. In this vein, I utilize a comparative history model that focuses primarily on race, gender, and medicine. Because, you know, a lot of times when I have students, I'll say, who's been to a gynecologist? Who knows what a duck-billed speculum is? Who's been born, right? So that means every person has had a medical experience, right? And so that's what this work does. And it privileges the contributions of white medical doctors who transformed women's healthcare into modern gynecology, but also I demonstrate how the progress of this branch of medicine would not have developed as quickly during the 19th century had it not been for thousands of enslaved women, and to a lesser degree in the urban northern centers, poor immigrant women, I look at the Irish, who suffered from so many gynecological ailments and diseases. Medical bondage demonstrates that the linkage between slavery and immigration was deeply intertwined with the growth of this branch of medicine. And yet, the greatest intervention that my book makes is its theoretical offering. You know, in order to get tenure, in order to show that you're smart, you have to have a theoretical offering. And I'm such an informal person, so you know, I had to think quite deeply about this, and I thought about the concept of medical superbody. So what is that? It's a term that broadens our discussions, our thinking, to include the experiences of Black women as both medical subjects, right? That they're living, or were living, breathing, fully three-dimensional human beings, but also objects, right? So if you are a slave, you are a human and property in terms of the legal rendering, right, of your position in society at that time. And so I assert that Blackness served as a mapping tool for racialized women who represented two of the 19th century's most vulnerable patient populations, the enslaved and the poor immigrant. And so often in medical literature, they were rendered exceptional because of their alleged strength and ability to withstand pain during surgeries and childbirth. And you'll hear in some of the medical case narratives that I share, right, that this constant referencing of Black women, enslaved women, being able to birth children without feeling pain. Yeah, I know, I like this crowd. I heard. And I see a good crowd. This is my sorority sister from Brooklyn, New York. Who came to Philly. How fabulous. Thank you. So after Congress banned 1908, American slave owners became even more interested in increasing the number of slave births in the United States. At the same time that America's stature was rising globally, especially as an increasingly profitable slave-based nation, another one of the country's industries, namely reproductive medicine, was developing and expanding rapidly. And this is what I often tell students in my intro to American race and medicine courses, that until the advances in dentistry and gynecology, right, American medicine was pretty static. The way people had practiced centuries before was the way they were practicing until these advancements in these particular fields were made. And so it was not long before medical doctors and slave owners began to work closely to protect the reproductive health of Black women who were held in bondage. Doctors developed complex relationships with slave owners, slave traders, each other, and finally the enslaved women they treated for gynecological diseases. Despite the complicated connections white men and Black women had with each other as doctors and patients, all involved in gynecological medicine, sometimes these men worked collectively with Black women, but most times labored separately to maintain and protect the reproductive health of enslaved women so more Black children could be produced. As Black women's birth rates grew, white medical doctors began to work in midwifery in greater numbers. Midwifery was not a field that men controlled. It had been the domain of women for centuries. And founding, its citizens believed maintaining women's health was a job divinely ordained for women. Although there was a long history of male involvement in women's health in Europe, American women, like most women globally, tended to each other when they gave birth. Despite women's predominance within the field, American doctors began to masculinize obstetric and gynecological medicine through institution building and cultivating pedagogical or teaching approaches for men who would work exclusively on women's bodies. These early Americans were building on a practice begun by the European predecessors nearly a century before. American men's entrance into this exclusively female terrain was regarded by some citizens as not only intrusive, but also unnatural. Their outcry gained attention as the criticism entered the pages of colonial newspapers like the Virginia Gazette, where male midwives were called immoral, as one Virginian described them in a 1722 opinion piece. So trolling is not new. Despite these initial protests, however, white men still entered reproductive medicine over the course of the long 19th century. As a result, formally trained doctors devoted serious considerations to the complaints, conditions, and diseases of women. As these men became increasingly more concerned with formalizing medicine more broadly and legitimizing certain branches of the field, such as obstetrics, they transformed it into modern American gynecology. Most importantly, women's health improved globally as early American gynecologists began to innovate surgical procedures that aided in successful cesarean births, obstetrical fistula repair. I promise I will give you a full-on description that you probably don't want to hear later on in the talk about what these terms mean, and the removal of diseased ovaries. The partnerships formed by medical doctors, especially Southerners, with slave owners to treat the reproductive ailments that affected enslaved women gave them even greater access to Black women's reproductive bodies, and later in the century in the North, for Irish immigrant women. Male midwives relied on the bodies of the enslaved and the poor to advance their medical research, create effective surgical procedures to cure women of formerly incurable gynecological conditions, and to a lesser degree, to provide a teaching model for physicians who were interested in understanding what they believed to be the biological differences between Black and white women. In slavery, healthy Black people who could labor made the system economically valuable. Within the professional women's healthcare world, deceased and living Black women's bodies were profitable. Doctors used the diseased reproductive organs of Black cadavers to facilitate gynecological research and provide education in the field of gynecology. Medical men achieved their educational goals through the publication of their research in medical journals and also inside hospitals and medical colleges where gynecological medicine was being taught. Medical journals had increased in popularity with not only physicians, but also Americans interested in learning more about medicine, as most healing occurred at home. 20th century medical librarian Merle Ebert, whose work provides the genealogy of American medical journals from 1797 to 1850, wrote, and I quote, "The advent of medical societies in America, combined with the need for better communication among Native physicians, produced the first truly American medical periodical literature." So medical journals symbolize the growth of modern American medicine because they allowed doctors to make demands for definitive ethics and practice, medical legislation for the protection of patient and physician, and the reorganization, expansion, and adjustment of medical education. Becomes a little murky though when you're dealing with people who are considered movable property, right? Who don't own their bodies legally. So antebellum era doctors who wrote articles that were supposed to be devoid of biases offered writings that were not value neutral and offered, in fact, what we would consider very prejudiced claims about patients based on race, gender, class, even size. Much of their writing was based on the scientific racism of the day. Gynecology specifically, unlike other branches of medicine, was becoming increasingly more scientific because of its growing focus on research and experimentation. Gynecologists seem to reflect a broader belief that their forays into formal medicine, which privileged clinical trials and experimentation, could be trusted precisely because it was becoming a male-led field where publications expanded their professional scope as pioneering gynecologists. So particularly by the mid-19th century, physicians' medical writings offered both laypersons and professionals alike foundational tests for how to treat and think about Black and white women and their perceived differences based on biology and race. And this is, you know, a really interesting kind of trivia fact that I give to students, and they are just amazed because, of course, everybody thinks when they're born they are the most progressive, they have, you know, they're the most organized. And so I often say, do you know slave owners and overseers and people interested in the institution had management journals and organizations. And in these management journals, what the largest number of articles were almost always based on slave medicine and health, right? And so they were also reading medical journal articles very closely and very thoughtfully because there was an economic investment, right, in these valuable bodies to get them healthy, right? Or the 19th century term, to keep them sound, right? Soundness was. So these doctors understood at the time, as historian Bruce Dane has argued, that sharp distinctions between 19th century biology and 18th century natural history was not tenable. Natural historians focused on organizing and understanding plants and animals, but they did so by using language that attributed human traits to plants' fertilization and animals' mating that they likened to courtship rituals. By the 19th century, scientists and later medical doctors began to not only study human beings, but also research ways to treat their diseases. There was a blending of science and medicine that occurred during the 19th century that opened up space for research and more entrenched racial categorization to occur. Medical journals symbolized this merger. Historian of slavery and now capitalism, Walter Johnson described medical journals as a site where race was daily given shape. Racial reification, right, making something abstract real, occurred in these journals when questions emerged over whether certain diseases, features, and behaviors were endemic to women of African descent. For example, steatopedia. Right? Let's see if this works. I might just have to do this. Go old school and hit enter. All right. Instead of the clicker. Right? This is a drawing. Have many of you heard of the Hottentot beans? Right. So this derisive name for Saartjie Baartman or Sarah Baartman, who was a Khoi woman born in South Africa, who was kidnapped and sold into essentially a kind of individual slavery when she was 17 and about to be married. And from this illustration, extracted from a popular newspaper of the day in London, you can see that there is this kind of duality of disgust and also excitement, right, and interest in something, you know, that's as simple as her having large buttocks. Right? And so it's given a medical term, right, that in fact her having large buttocks is a medical condition, right, these kinds of things. Right? Also, you know, to kind of harken back to the discussion of natural historians, you know, that kind of predominated in the 18th century. After her move from London to Paris, she was then housed in an institution and studied by scientists, but also natural historians, right? And these are people who kept animals and plants. You know, it's kind of a menagerie. And Saartjie Baartman was a part of that. And a lot of the research that was being attempted on her body was to see whether she had a hooded clitoris, right, and elongated labia. She didn't. Right? I mean, she was a human being. She was a kind of regular woman, right? But this notion that her body had to be biologically distinct from white women's bodies. So large buttocks, elongated labia, low-hanging breasts, and lasciviousness, right? This kind of hypersexual attitude all seem to be embedded in black women's bodies. So the discourses on bondswomen and other racialized so-called inferior bodies have resulted in the black female body serving as, and I love this term from Hortense Spillers, a resource for metaphors, according to her article, Mama's Baby, Papa's Maybe, an American grammar book on race. And in it, she lists these denominators in the American grammar book, right, on race that range in descriptions from the Hottentot Venus to humble Negro servitor, as James Marion Sims called his enslaved experimental patients. And one of the most commonly referred to metaphors for enslaved black women was breeder. In 19th century America, metaphorically and literally, the slave and later in the century, poor immigrant woman epitomized the breeding woman. These names were all rooted very deeply in America's long fascination and interest in black women as hypersexual beings. Even as medical branches like gynecology and obstetrics grew, black women and those for whom blackness was mapped onto were seen as willing servants for white medical men because they were impervious to pain. Historian Londa Scheenbinger found that for 19th century American physicians, females in general were considered a sexual subset of their race, the male body remained the touchstone of human anatomy. Black women were especially exceptionalized. Scientific theories and later medical ideas about their bodies, their fecundity, right, their ability to get pregnant, and their supposed abnormal ability to endure pain in childbirth can be traced back several centuries to the writings of early European natural historians and male travelers who visited the continent of Africa. Consequently, American reproductive medicine was influenced greatly by biologically rooted racism. Enslaved women were perfect medical subjects for gynecological experimentation because doctors deemed them as racially inferior to white ladies because of their research findings and black women's low statuses. Simultaneously, however, black women were still valued and vital within American society because they produced a growing slave labor force that yielded much wealth. So with a firm belief that women were literally the weaker sex, American doctors began to publish their writings and tightened their lens on women's health. As a result, their articles were overwhelmingly on reproductive medicine. In this branch, early gynecologists determined that the natural functions women experienced, like menstruation and childbirth, were conditions that needed fixing, since women sought out the services of professionally trained doctors in cases of obstetrical emergency. Medical men tended to publish more and more articles about abnormal births, right? A doctor is not going to come to a delivery of someone who's having a perfectly normal birth, right? They're attending to people who are having protracted labor and abnormal birthing sessions. So the gynecological landscape changed, and traditionally normal biological processes like pregnancy and childbirth were beginning to be treated as medical conditions. So what distinguished gynecology from midwifery was the former was surgery, and doctors used tools like forceps, that's on the cover of my book, instead of their fingers, and in rare instances anesthesia, although its use was rare and given to the most elite obstetrical patients. In one of the earliest cases of an American being given anesthesia to reduce the pain of childbirth, Fanny Wadsworth Longfellow, wife of the famed poet Henry Wadsworth Longfellow, became the first woman in the United States to give birth with the aid of pain relief administered by a Boston dentist. Longfellow's case demonstrates how elite white women believed in their fragility, right? Not just them, but the men who were treating them, in their fragility, and allowed doctors to numb them from the pangs of childbirth. Despite the growth of reproductive medicine, however, general medicine was still folk-based and fairly static in terms of its development in surgical and scientific innovations until the emergence of dental and gynecological surgeries and the use of anesthetics in surgeries. So as early American gynecology emerges from its nascent state, many Southern men interested in entering the field moved away from home due to the dearth of local medical schools in the region. By 1841, there were only 7 medical colleges in the South. So in fact, I'll talk about James Marion Sims in a bit, but he leaves his medical school in his home state of South Carolina to attend Jefferson College, a Jefferson Medical College here in Philadelphia, right? Gets his degree and then returns back to South Carolina. So while many Southern men learned medicine through apprenticeship to local doctors, some sons of the South traveled to the North, but also to leading European medical centers in metropolitan areas like Edinburgh, London, and Paris for formal training in the healing arts. Those who remained in the United States, as I said, tended to seek their medical educations in places like Jefferson Medical College. So notwithstanding the small number of Southern medical schools, the region represented an important site for pioneering innovations and achievement in gynecological medicine. And it's interesting to me, as someone who does study and teach Southern history, right, that there's this notion that the South was really quite backwards, and we don't give a lot of attention to the pioneering works that were coming out of the South with regard to obstetrics and gynecology and dentistry even, right? And so that medicine becomes a way for the South to be able to have, and really to take center stage, right? And take center stage in the Western kind of medical enterprise that was growing in the late 18th and the 19th centuries. So commenting on this issue, historian Joseph Waring noted Black Southerners, mainly the enslaved, provided doctors with, in his words, great opportunities for the acquisition of anatomical knowledge. And so Southern physicians carved out paths that guided their peers about how to treat and think about their patients based on their race and gender. So prominent men like Ephraim McDowell, right? And this is the thing, I often get questions that only center on James Marion Sims, because he has been in the news a lot, and I'm like, I wrote about other men. Other folk are called father too, right? I mean, we as Americans, we love to call the founding fathers, right? The father of this, the father of that, the Carter G. Woodson, the father of Black history. And so there really is a kind of history and culture, cultural practice around naming people the fathers of certain branches of things, right? The nation or history, or the unit of variety, right? John Peter Matara, right? I even heard at one time he was called the father of plastic surgery, right? But he actually did pioneering work in obstetrical fistula before James Marion Sims, right? And he had several years of experimental work on an enslaved woman and a white woman. The white woman was cured after several years, maybe 1 or 2. The enslaved woman was never cured of her, then it was called vaginal fistula. And she wasn't cured, John Peter Mattel wrote, because she could not stop having sexual intercourse. Right? And so he writes this in his medical article that he was just angry that she would not stop having sexual intercourse. Right? Francois Marie Prevost, I don't have a picture of him, but he was considered the father of the cesarean section. And then James Marion Sims, who most people know in the kind of world of American early medicine, was known as the father of American gynecology. And these men revolutionized the field of gynecology, and they did so primarily on enslaved women. Ephraim McDowell offers a different story. His first patient was a white woman where he removed the diseased ovaries. All of his other experimental work on removing diseased ovaries or tumorous ovaries were done on enslaved women. They legitimized American medicine through their work, and the larger Western world's medical researchers and peers took notice. Thus, American slavery and early modern gynecology have intertwined roots that are Southern. As much as white medical men are lauded for serving as the fathers of American gynecology, Black women, especially those who were enslaved, can arguably be called the mothers of this branch of medicine because of the medical roles they played as patients, plantation nurses, surgical assistants, and midwives. The professionalization of American medicine during the early 19th century culminated in the establishment of the American Medical Association in 1847. Medical doctors' interest in establishing national reputations for themselves worked alongside their desire to build institutions. So the antebellum era introduced gynecological research findings from successful surgeons who first performed abdominal operations that removed diseased ovaries. That was Ephraim McDowell, right? The first successful abdominal-based surgery in the Western world, at least recorded, was done in Kentucky in this little frontier town by Ephraim McDowell. They delivered babies via cesarean section. Francois Marie Prevost has a very interesting history. He was French-born, lived in Haiti, had experimented on enslaved women in Haiti. The revolution breaks out. He runs out of Haiti, or is run out of Haiti, and moves to Louisiana. Guess what he does? He continues his experimental work on enslaved women to perfect C-sections. Right? And they repaired vesicovaginal fistula, a common but non-life-threatening condition that affected many pregnant teenage girls and women. And so what happens is during childbirth, when vaginal tearing occurs, the woman's bladder, vesicle, became exposed because of the fistula or hole formed during the process of pushing the child out of the birthing canal. So as you can imagine, these are women who are in labor for 2 to 3 days. And so you're trying to expel, right, this being out of your body, and so there's going to be friction that occurs, and that's where the fistula, the holes, are formed, and they can range from microscopic in size to gaping holes. And so once that upper vaginal tissue was sloughed away, an opening allowed for a continuous involuntary discharge of urine into the vaginal vault. And so as you can imagine, fistula patients suffered from incontinence, infections, emitted strong odors. They suffered from depression. These were young women, primarily, many of them were young women. And they were quite often ostracized because of the stench that emanated from the constant stream of urine. If there was anal tearing, you can guess what the incontinence was composed of. And so it was really a condition that emotionally scars these women. And also they are now ostracized from members of their community. And in turn, they lose value as breeding women for their families. So because the future of slavery and with it of the South's growing ascendancy as a global economic leader depended on black women's fecundity and the birth of their healthy slave offspring, Southern doctors found no shortage of bond women to examine and treat for various gynecological ailments. They removed burst ovaries, sutured holes in bladders, delivered stillborn children, and removed tumors. Southern slave communities were so flush with sick bodies that Dr. James Marion Sims boasted, and I quote, "There was never a time that I could not at any day have had a subject for operation." Ephraim McDowell, now go back to his picture, who is known as the father of the variotomy, highlights how easy it was for Southern doctors to locate black women with gynecological diseases. McDowell was born in Virginia to a military officer and government official in 1771. His mother was a housewife, but he grew up in Danville, Kentucky, then considered the Western frontier. As a young man, he entered the medical field, serving as an apprentice to a local medical doctor. His apprenticeship ended abruptly when he and his friend were accused of grave robbing. Dinah Rainey Berry just wrote an op-ed in the New York Times about this, and I'm like, as a historian of medicine, it's so funny. I have such a great personality. I promise you I like to smile and laugh. My husband accuses me of being morbid because of the histories that I write. The next one I'm interested in is slavery and mental illness. And he's just like, can you write something happy? It's slavery, man. I'm like, yeah, right. It's slavery. So, this thing that historians of medicine have, we've known about grave robbing all along. I'm so happy that we now have historians who are doing the kind of public history work to get this information out, right? And so you can see how slavery was literally intertwined in almost every institution in this country. So McDowell is accused of grave robbing. Because he comes from a very elite family, he leaves the country to study at the University of Edinburgh. After his stint in Scotland, he returns to Kentucky, where he began treating the local community that was mainly comprised of white people and a smattering of black people. As you know, Kentucky never really had a large slave population compared to the other slaveholding states. And so in 1809, Ephraim McDowell performed an ovariotomy on Jane Todd Crawford, a middle-aged white wife and mother. If you have time and you suffer from insomnia, you can always go on YouTube and find the ABC miniseries that came out called The Long Ride, based on the story. I promise you learn all kinds of things doing this. And so he performs this surgery on her, believing that Mrs. Crawford was experiencing a difficult pregnancy. McDowell found that, in fact, she had a tumor. He informed her that he would have to remove it surgically. So Danville, Kentucky was a small town, and through the local grapevine, word traveled that McDowell had planned to cut into the woman's abdomen to perform an ovariotomy. Surgeries were exceedingly rare. No one attempted a surgery on the abdomen, especially 1809 in a frontier town. So, people, rightly so, believed correctly that abdominal surgery meant certain death for the patient. So nonetheless, early on Christmas morning, Dr. McDowell, in secret, removed Mrs. Crawford's tumor, which weighed over 20 pounds. Oh. Amazingly, she survived and lived until she was 78 years old. McDowell then waits nearly a decade before he published a groundbreaking article that described his successful variotomy procedure. But this time, it's called, instead of one, 3 cases of, the titles are very long during this time. As many of you know, if you've done research here, very long titles. The 3 cases of extirpation of diseased ovaria, and it appeared in the Eclectic Repertory and Analytic Review in 1817. So after the article's publication, McDowell's peers derided him, especially those in Europe. They were the most vocal in their criticism of him because American medicine was still in its infancy, and they believed, rightly so, it was pretty static, it had not produced any trailblazing doctors. One of the leading critics, British surgeon James Johnson of the London Medical I never can say this right, Chirurgical, correct me if I'm wrong, Chirurgical Review, called McDowell in his words, a backwoods Kentuckian. Dr. Johnson wrote, all of the women operated upon in Kentucky, except one, that would have been Mrs. Crawford, were negresses, and they will doctors, our wonder is lessened since they understand black women's propensity to handle pain with effortless. So despite the criticisms he faced, McDowell continued to conduct experimental surgical work on women, but now all of his patients were black. I couldn't find if they were all enslaved or some enslaved and some free. Often, as you know, for black people in general, the record keeping was not that great. In fact, the record keeping sometimes tended to be better for slaves because people were much more invested in their property. So McDowell found 4 black women who suffered from ovarian tumors in the local Danville area to experiment on over the course of nearly a decade. And for me, I remember thinking this was a stupefying accomplishment, as the town had a black population around 4%. So how do you know, right, to locate these women who are suffering from diseased ovaries in a town that literally has a 4% black population? McDowell's example shows how American gynecology was being formalized and legitimated on the reproductive organs and bodies of black women. One of the women did die under the experimental operations with McDowell, and that was quite normal during the 19th century. So like Dr. McDowell before him, James Marion Sims was a Southerner who advanced gynecology through his cutting-edge medical experimental work on enslaved women. He was born in Lancaster County, South Carolina in 1813. Sims came from more humble beginnings than McDowell. After finishing his undergraduate studies, Sims decided to attend medical college in South Carolina, but left to finish medical studies at Jefferson Medical College here in Philadelphia. After graduating, he returns home to establish a medical practice. However, the deaths of 2 patients, 2 Negro infants, ruined his professional reputation in his town, and he then relocates to another western frontier town, Mount Meigs, Alabama. After a few years in Alabama, Sims became a well-respected doctor, and he began actually a quite prolific publishing career about his medical work by the 1840s. Like most men who entered gynecology during the first half of the century, Sims did so because of the urgent needs of women who suffered from a plethora of reproductive ailments. In his autobiography, Sims wrote about his initial distaste for gynecology. He stated, and I quote, "If there was anything I hated, it was investigating the organs of the female pelvis." And so, some of you might know this, my students are often quite shocked. Doctors don't really, especially medical students, so let me back that up. Medical students, when they are in medical colleges, they are not actually touching the women's bodies, right? And so you might find someone who's kind of trying to feel, the woman's organs, up underneath a long hoop skirt. But these are not people who are actually laying hands on bodies while they're students. Hence, Ephraim McDowell grave robbery, right? I mean, they want to physically have an opportunity to touch the bodies, understand what a liver looks like, and these kinds of things. So Sims chose to perform a vaginal examination on one of his white patients. Very unusual. Her name was Mrs. Merrill. She was thrown from her horse while just riding to run an errand, and was found to have a reversed uterus. So remembering a medical lecture he attended while a student, he opened up Mrs. Merrill's vaginal cavity wide enough so that the force of air pressure would help to pivot her womb to its right position. It was literally at this moment that Sims writes, right, that he was reminded of enslaved patients who had earlier visited him because they suffered from vesicovaginal fistula, believing if he could apply the technique he used on Mrs. Merrill on the 3 enslaved obstetrical fistula patients, Sims was certain he could cure them of their condition. Obviously, this is not a true-to-life rendering of what happened, right? But this is Sims, and this is a very famous painting. It's on Marie Jenkins Schwartz's Birthing a Slave book cover. It is housed in the University of Michigan, and it was painted by 20th century artist Robert Tom. And there was a medical, actual series of kind of pioneering medical events in American history. And so this was Tom's rendering of the moment that Sims and his 2 assistants, one of whom is Nathan Bozeman, who also achieved fame in kind of early gynecology for his button suture method to suture up the fistula as compared to Sims's silver suture method or silk suture method. Anyway, he paints this, and it's really interesting too, right? So here you see 3 enslaved women who are neatly dressed and covered, you know. In fact, and Narka has on a red scarf and some earrings, right? The other 2 are allowed, they're permitted to kind of peek from the curtain. It's a very sterile environment, and Sims is just kind of, you know, in deep thought. His assistants are there, and in reality, this is not how surgical spaces work at all for any patients, right? I mean, anesthesia is not being used. People are trying to fight and get up, and, you know, because they're being cut and they're conscious. And so, you know, this is a very sanitized scene, but it also, I think, is indicative of when it was painted in the mid to late 20th century, right? Late 50s, I think early 60s or so, and this is a moment of the modern civil rights movement and this way in which, right, this moment in U.S. history is also merging with civil rights history during this time. But a very interesting kind of rendition of what happens. In the real illustration, you will find that the nurse, the patient, and Sims are all white. Although Sims writes in the article that he is working on enslaved women. Right? That's a different lecture for a different time. And so Sims' first enslaved gynecological patient was Anarcha, a 17-year-old girl who the doctor first assisted during her protracted labor. During the 2 days she was under Sims' care, he found that as a result of a difficult birthing process, Anarcha had developed the vesicovaginal fistula that I described earlier. Before his work on Mrs. Merrill, Dr. Sims had informed her owner, Mr. Westcott, that Anarcha has an affliction that unfits her for the duties required of a servant. Very quickly, Sims sent for 2 other women, right, as kind of painted in this, drawn in this painting, Betsy and Lucy, 2 more slaves who had visited him because their owners had complained of their fistula condition as well. In his memoir, Dr. Sims wrote that he later, in his words, ransacked the county and found 6 or 7 cases of vesicovaginal fistula that had been hidden away for years in mountain eggs. And so this is also the interesting thing. The reason that people call the names of Anarcha, Betsy, and Lucy, as they should, is because those were the only names recorded. Right? So there were more experimental patients. We just don't know who they were. And this is a picture of the hospital that Sims actually performed the experimental surgeries. And it's interesting because in my book, I am very clear that this is the first women's hospital, right, in the country. And Sims never hid what happened here. In fact, he sells it to one of his former surgical assistants, Nathan Bozeman, and Nathan Bozeman continues experimental work and gynecological work on enslaved women, for a very long time after. And so this picture was obviously taken after slavery, but this is the hospital, right, where these enslaved women helped build it, and they tended to each other, and they assisted Sims during the experimental trial. So between 1844 and 1849, a 5-year period, Dr. Sims experimented exclusively on enslaved women's bodies to aid him in locating the cure for this condition. In a speech he made some years later before the New York Academy of Medicine, he explained how he became a successful gynecologist. In his speech, he intoned building a little hospital as a special field of experiment. He did not build anything. He had his slaves build it for him, just so that we're clear. He told his audience, I readily got control of these cases, all of them healthy young Negro women, right? Healthy, and yet they were experimental patients for 5 years. Dr. Sims' establishment of the Slave Women's Hospital proves how doctors began to recognize the importance of women's medicine. He continued his experimental surgeries on the so-called healthy young Negro women. Failing to cure any of them after 2 years, Sims lost support of the local white community. This included white residents who observed his public surgeries, also the young white medical apprentices who assisted him at the start of the experimental trials. So at this point, he's not done. He hasn't found a cure, and so he does what any slave owner, and Sims was a slave owner, any physician would do. He trains the people who are there to assist him, and in his case, he trained his slaves. As a result, he trains his enslaved experimental patients to also work as surgical nurses and assistants. So the peculiarities of slavery meant that these women, who comprised those slaves Sims leased and owned, would be trained as skilled medical workers, and yet they would still have to labor as domestic and agricultural slave workers. It was a heavy double burden to bear. Their lives show how convoluted the nature of 19th century medicine was in matters of race, class, gender, and status. To more fully grasp the nuances of modern American gynecology's origins and expansion, one must consider the lived experiences of some of its first patients, these enslaved women. They suffered from a debilitating condition that Sims described as being unfit for the work they were to perform. Additionally, some of these women were forced to live miles away from their family and friends during the length of the experiment. We forget that they might have been mothers, right? They might have had husbands or lovers, parents, friends, and so here they are in another home for 5 years. They raised children without the presence of fathers around. They nursed babies while also healing the scars that they bore as experimental patients. But also, this is a rather large building, right? They provided labor in the fields and inside the slave hospital that Sims built for them. And they did so while under the fog of opiate-induced states post-surgery that kept them parched, constipated, and bound to their beds for at least 2 weeks while their bladders and vaginas healed. And this is where the controversy comes in. Often when people say, he was this evil butcher and he gave them opium, and I'm like, he was suturing holes. So you give someone opium to bind them, right? You have to ensure that they don't rip the sutures, right? And so that's what lots of doctors did, and especially in a frontier town like Mount Meigs, someone like Sims is not going to have, in the 1840s no less, access to anesthesia. And Sims comes from a kind of older model of American medical training and practice. Patients needed to be alert so that, A, they wouldn't bleed out, but also the doctors had clues. I mean, you scream, the doctor knows, right, that he doesn't have much time. So Sims would often write about how quickly he performed a surgery. In fact, Ephraim McDowell, who I mentioned earlier, spoke about the length of the surgery for Mrs. Crawford, because this was also alerting those reading the articles that you could perform these surgeries in a quick fashion so that the patients wouldn't bleed out, right? And that they could also, through their cries or answering questions, dictate for you how to treat their bodies as they're undergoing surgery. So after 5 years of medical experimentation and on Anarcha's 30th surgery, Dr. Sims successfully repaired her fistula, closing it permanently with silver sutures. Dr. Sims repeated the technique on the rest of his vaginal fistula patients, curing them all of the condition and perfecting the duckbill speculum. He was, in today's language, a kind of master brander, right? The position these women got in called the Sims position, right, for surgery. The speculum was called the Sims speculum. So Sims, would name surgical positions and instruments after himself, because as much as he was a pioneering gynecological physician, he was also a medical entrepreneur, right? Which went along with the ways that medical men integrated ideas about masculinity and success during the 19th century. They could, so these enslaved women could return to their former homes after being healed. And hopefully they would be reunited with family and friends, retain their value as breeding women who now possess the skill, nursing, that could increase their owner's wealth. In 1852, he publishes his article on the treatment of vesico-vaginal fistula in the American Journal of Medical Sciences, and 3 years later, Sims moves to New York, opens up the Women's Hospital of the State of New York. He had established himself as one of the country's preeminent gynecological surgeons less than a decade after he had began his gynecological career. So understanding the confluence of race and region is important because of the ways elite Southern white men viewed their role as not only protectors of women, but also as fathers, especially for those who were involved in slavery. The belief in themselves as great white fathers of their black slaves was popular. And so I'm going to actually step away from the paper here because this is a really interesting story, right? That Sims is called the father of American gynecology. And so, you know, this is the importance of archives and places that hold archives. Many folk have written about Sims before. And I remember thinking, gosh, what can I find? You know, all of the archival sources are kind of readily available for people to comb through and read and reread. And so I remember being in the National Archives in Washington, D.C. My mother, who is the family's genealogist, was begging to, to accompany me. So I was like, fine, just find something, use Ancestry.com, right? And so we're sitting there, and in the National Archives, I literally screamed because I had not seen anybody really write about the lives of these women that he owned. And so the 1850 census that was published, the census that was published in 1850, right after Sims's experiments end, was interesting, right? Because they collected data obviously before 1850, but what's interesting, he owned 17 slaves. So I asked myself, well, I wonder how many are men? No men. 5 of them are boys, and they are young, right? From infants to I think about 12 years old, if I'm not mistaken. The rest are women. Out of the women, about 9 are of childbearing age, right, that I can surmise. Of course, there are no names. Like I said, the only names we know are those of Sims telling us Anarcha, Betsy, and Lucy were a part of the cohort of women that he experimented on. And so I noticed out of the children, there's one little girl who's listed as a mulatto, born during the time of the experimental trial. And so, I often ask, what was he really the father of? Now, census can't tell us, right? The census can't tell us what Sims did or didn't do. But what we do know from decades and decades and decades of research on women in slavery is that lots of enslaved women had mulatto children, right? And so if it wasn't Sims, some white man in Mount Meigs, Alabama had access to one of those women's bodies, and she produced a child who looked so different, right, in this small community that she was determined to be a mulatto child. And so this brings up all kinds of questions of biomedical ethics that we may never know the answers to because the census can only provide so much, right? But, the wonderful thing about being a researcher and being a writer of these people is that you're able to at least pose the questions, and people are then inspired to do their own research. And so this is, a sad tale, but also I think quite a fruitful one. And I know that there's someone right now who's engaged in trying to find out the life of Anarcha and some of these other women that Sims had access to. So who knows, maybe another book will be written. And I'll be very interested to read it. But these are some of the questions that I was left to ponder. So it also then made me ask other questions. Remember, the white community withdrew support around the time that this woman might have been pregnant. Now, once again, I don't know. I wasn't there in the 1840s. I don't know, right? And Sims is not going to write this or write about it in his diaries or anything. But once again, I'm like, was it just that the experiments were failing and the community was kind of outraged that he was, it had been hinted that he had been using them like guinea pigs? Surgeries were still rare, right? Doctors were not as revered as they are now during this time, especially in a burgeoning field. And so, there are all kinds of ethical implications around the birth of this unknown mulatto girl born on his slave medical farm. So pioneering men like Dr. James Marion Sims were heirs to a legacy left by a long line of older Southern physicians and scientific researchers who relied on enslaved Black bodies to find cures for ailments that affected all races. In a lesser-known medical case, President Thomas Jefferson began a smallpox vaccination experiment in 1801 that included both Black and white members of his family, literally, and metaphorically, and a few of his neighbors. Interestingly enough, Jefferson did not want white infants, some of whom were being nursed by vaccinated enslaved women, to become infected with smallpox, especially if the experiment failed. So he ordered that only the Black babies would suckle from enslaved women and risk infection. A few years later, cesarean section surgery was pioneered in Louisiana, as I mentioned before, solely on enslaved women by French-born surgeon Provost, who had repatriated to the southern state from Haiti after the Revolution. So gynecological surgeons during the early and mid-19th century were neither exceptionally cruel nor sadistic physicians who enjoyed butchering Black women's bodies, as some critics have argued. And the reason I say that is that when you enter into a legal contract with an owner, you can be sued for damaging property. The treatment of Sims with his experimental Irish immigrant patient, Mary Smith, was, let's just say, he literally abandons her after he messes up the last surgery in her 6-year experimentation and kicks her out of the hospital, and she later dies, a transient woman in New York, right? He couldn't have done that with these enslaved women because he would have been sued by the slave owners with whom he entered into a business contractual relationship with, right? And so that is the very thing. Regardless of whether he respected them or not, he probably didn't, right? Because of the ways that people thought about Black women and slaves, but he was under the legal, the kind of legal heir to protect these other men's property. So they were elite white men who lived in an era where scientific racism flourished, ideas about Black inferiority were established, and widely believed as the underlying assumption held about Black people. Black women were a vulnerable population that doctors used because of easier accessibility to their bodies. Further, the value of Black women's reproductive labor demanded that it be fixed when it was seen as broken by those who depended heavily upon their labor. As elite medical men like James Marion Sims and his colleagues met the demands of clinical practice and those of clinical investigation, they were confronted with the challenge of experiencing Black women's lives, most of whom were mothers that existed somewhere between humanity and science. And I thank you very much.
So we have a few minutes for Q&A.
Yes.
So, I was reading about the recent opioid addiction, and I don't remember what sources from one of the universities, and they were saying that the reason that the opioid addiction is more prevalent in the white community is because a lot of the doctors, when they interviewed them, said that they believed that Black people felt pain as much, so they didn't prescribe opioids. So when you were writing this book, did you, and maybe this is your next book, think about how all of what was established in those writings still impact even like the medical journals that are coming out now?
Yeah, it's, thank you for that question. What's really interesting, and I know exactly the study that you're talking about, there were a few, but the most recent was a 2014 study out of the University of Virginia, where medical students, especially some medical doctors, but largely medical students, were being taught that there were distinct biological differences between black and white people, and that black people did not experience pain, not even black children for very painful conditions like kidney stones. And so black patients, even those who who have chronic illnesses like sickle cell, are not being given pain medication because of this belief. I mean, you could go on, right? There's a nursing textbook out of Canada where there are different sections about how to treat different races, right? Based on literally the same information that James Merton Sims was learning in the 1830s.
And what's the date of that?
The nursing article, I think, was it was a viral post, and so I think it was 2016, or around that time. This is, this is new. This is not stuff from like 1953, 1932. This is 21st century medical education publications. And very elite schools, right? It took a lot for me to get into UVA's postdoc program, let me tell you. Very rigorous and very competitive. So yeah, I mean, these are elite schools. Yes, sir.
Are there any comparative statistics on black women and white women who died in childbirth?
Ooh, during this time,
Yeah.
you know, so the numbers are not hard and fast. And so what most people would write without precision is that black women tended to have lower birth weight, lower birth weight infants, which happens still now. And they died in childbirth, unfortunately, which is still happening now. And unfortunately, those numbers are increasing, sadly. The CDC just came out with a study based on some research. Another viral post where one of the researchers actually died. And so, this cuts across class. Oftentimes people will target the poor members of a community. And so within the African American community, it doesn't matter if you're middle class or educated, people are still giving birth to low-weight babies, and also mothers are dying with much more frequency. But the numbers in the 18th, 19th century are not that precise, unfortunately. But thank you for that question. Yes, Nazira?
Did black doctors start learning the field of gynecology like in the 19th century also with the birth of black hospitals?
Late 19th century. It's very interesting. There's a medical practitioner, Dr. Wall, who was also a medical historian, and so I was able to, through a journalist friend, get information that Wall had on Sims. And so when Sims becomes president of the AMA, after slavery is ended, post-Civil War, he's confronted with the woman question and the Negro question. Sims is a lot more conciliatory to Negro men becoming doctors. He'll deal with white women, right? But he's a little more conciliatory if it needs to be done, right? And so there are not a lot of black hospitals. Black people, nurses, and not many doctors at all during this time period, but the nurses are still kind of working in informal spaces. And this is also what what the patients prefer, because they're not intrusive, right? I mean, do you really want someone coming with surgical tools, or someone telling you, if you drink some brandy with some cloves, right, it might lessen the pain, right? I mean, so there's also a sense of people not wanting to feel pain, because you're already in pain.
So I'm sure people have asked you to weigh in on the kind of very public debate about the removal of statues or monuments dedicated to Sims. And of course, this is happening in a moment where we're wrestling with the movement of other monuments as well. So I thought maybe you'd want to weigh in a little bit on that.
Well, we're being streamed on YouTube, and my face is all, yes, it's everywhere. I'm like, no, that's yes, I've been asked that question. I've written an article, and I had to deal with it. What I would say is there are 3 statues that we know of in the country dedicated towards Sims. Sims's memory. One in Central Park, that's the one that has kind of, taken over the conversation. One in Columbia, South Carolina at the State House, and then one at the State House in Alabama. Believe it or not, as long as I've lived in New York for 4 years, I've not been to the Sims one. I'm like, I know how he looks. Because I'm a South Carolinian and I had to do research, I did see the one in South Carolina at the State House. So this is really interesting. Let me start from South Carolina. The mayor of Columbia wants the statue to be removed, which is quite interesting. I don't know if he has a lot of public support. In New York, a decision was made, I think maybe 3 weeks ago? Yeah, very recently by Mayor Bill de Blasio and the Parks Commission, City Commission, to have the statue removed. The only one in New York, and it will be removed to Greenwood Cemetery in Brooklyn, where Sims is buried. So everybody's like, oh yeah, where he's buried, right? So that's happening in New York. But what is really interesting for me, I graduated from UCLA in 2008. So this was still a dissertation then. And I remember being scared to death because 2 books had come out, Harriet Washington's Medical Apartheid, Marie Jenkins Schwartz's Birthing a Slave, and I thought, oh gosh, no one will want to read my book. And there was a controversy around Sims's statue then. People didn't take it seriously. It was just, these liberal, crazy women are arguing about this thing. Why do they want to kind of, write over history and act as if Sims didn't make these contributions? Why people took it seriously now is because folks started toppling Confederate statues in the South. And so here was a moment. I mean, it worked so well for me. My book was published early. My editors were like, hey, we got to get this out of here. For the Times. No, thank you, sir. I've been trolled by the far right. I'm good, right? But literally, it's true. Twitter is, so, but I share all of that, in jest, but also in seriousness to say that we are now in, unlike 2008, a kind of new iteration of what I call the politics of black rage and discontent. And this is now the Black Lives Matter iteration, right? We didn't necessarily have that name to attach to black people's anger and rage over these cultural symbols and historic symbols in 2008. And that doesn't mean that it didn't exist. People just didn't pay attention. But because you now had a kind of multiracial group of young folk in particular climbing up and snatching down Confederate flags, right, in South Carolina, going in North Carolina and toppling Confederate statues, it seems quite interesting to me that although the East Harlem Preservation Society, which had been the most long-standing group to remove Sims's statue from Central Park, which was right across from the New York Academy of Medicine, an organization for which he was a member, that Bill de Blasio and the Parks Commission has only agreed to remove that statue and not the others, because there are protests to remove Christopher Columbus's statue, right, in New York. Veronica knows she lives in New York, and they are not removing it. So I really think it is about kind of Black Lives Matter, the Confederate statue issue, and this is a way to also say that the North's hands are not clean, right? That they also have ties to this part of history that people kind of don't want to talk about in very public ways, except at the library company.
Well, I know we're running short on time, so what I want to make certain is that we have an opportunity to have a book signing with Dr. Cooper Owens, but let's offer her a round of applause. So I thank all of you for joining us this evening at the Library Company, and we have books on hand. So please, we'll have an opportunity for Dr. Cooper Owens to actually sign your books. So thank you all, and once again, happy Black History Month.
I just want to second Dr. Dunbar's thanks. Dr. Cooper Owens, that was a fantastic talk.
Thank you so much.
Thank you. And again, book sale and book signing right here. But I did also want to point out we would love if we have a small reception prepared for you all in the next room. There is a piece of art in the next room that I think is incredibly resonant
Yes.
with what we're talking about. A board member of the library company, Michelle Flamer, who's here tonight, has created a small quilt in the other room, and the title of the quilt is Mothers of Gynecology. And it's a quilt that is actually dedicated to Anarcha, Betty, and Lucy, and is to commemorating their story. And it couldn't have a better audience, I suppose, or a better, more relevant place. So Michelle's here tonight. I don't know if she, maybe if you can catch her in the other room, she might speak to you about it. But it's we're very proud to have that to show you in addition to this incredible talk. So thank you again
The
for
only
coming.
thing I have to say about that quilt that's very interesting is that Dr. Sims, when I made the quilt over a year's period of time, not because it took that long, because it took that long for me to sort through all my feelings about it, I learned about Anarcha, Betty, and Lucy 10 years prior to making the quilt at a tea at Bryn Mawr College, a medical advocate ethicist. We had something, it was a Black Alumni Weekend, and she was talking about, I didn't know anything about these women at all. So then I read my story, which is Dr.
Yes.
Sims' autobiography. And long story short, I don't know what to think about Dr. Sims. I'm very conflicted about Dr. Sims. I don't think he was evil or sadistic, like some people, just sort of jump on that. But I'd rather validate the lives of those three women rather than Dr. Sims. So I'm happy that they're moving the memorial for him. Yeah, thank you.
Yep. Fake knows about that.
Yeah, you know, I go to the bar. Yeah, 3 or 4 times. It is that